Hello, and welcome to the Society of Critical Care Medicine's podcast. I'm your host, Kyle Enfield. Today, I'm going to be speaking with Dr. Brian T. Wessman, MD, FACEP, FCCM, and Dr. Fajun Wang, MD, from our Leadership Empowerment and Development Program. Membership in professional societies is a standard part of most medical careers. The Society of Critical Care Medicine encourages its members to take full advantage of its societal offering with the goal of right care right now for both medical professionals and the critically ill patient. This podcast will explore specific ways that SCCM members can supersize their societal membership and provide members with tools to get more engaged. Dr. Wessman is an intensive care unit and emergency department physician at Barnes Jewish Hospital. He is also the professor of anesthesia and emergency medicine at Washington University in St. Louis, the program director for Anesthesia Critical Care Medicine Fellowship, and the division chief for EM Critical Care Medicine. Dr. Wang is an assistant professor of neurology and the medical director of the Neurosciences ICU at St. Louis University. He also serves as the program director of the Neurocritical Care Fellowship and the associate program director of the Adult Neurology Residency. Welcome, Drs. Westerman and Wang. Before we start, do you guys have any disclosures you need to report?
No, sir. Thank you, Dr. Enfield. Appreciate that introduction. No disclosures on my end.
Thank you, Dr. Enfield. I don't have any disclosures either.
Awesome. So one of the things that I wanted to start off with was just the two of you talking about how you got involved in the SCCM and sort of what was your first year like in membership? Do you have any specific memories that really prompted you to stay involved in the society?
Yeah, great question. I actually was lucky enough to get exposed to SCCM while I was in residency. My actually first encounter with SCCM was through a Fundamentals of Critical Care Support course. We didn't have access to that here in the St. Louis region at the time, and we actually went up to Detroit, myself and another faculty member, to get instructor status in FCCM. And then we subsequently brought that course back to our home institution. I was still a trainee at that time, and it was just an amazing kind of bread and butter course to not only help out with skill set, but also knowledge base. And then subsequently, I had already had a thought of doing critical care training, got involved through the society while I was a trainee in fellowship, and then was lucky enough to then continue to go on to various annual meetings. And I think some of our questions we're going to talk about, we'll talk about some of those experiences at those larger conferences meetings.
Fajun, what about you?
Yeah, I had essentially a similar stories. I started to get involved with SCCM during my fellowship training. As you guys can imagine, as a neurologist, when I was in residency, I had no idea what critical care was about. And when I get called for critically ill patients in the emergency room or in the ICU, the things I would say was, well, get the patients better and I'll come back to see the patient. But when I started the fellowship, UPMC Critical Care Medicine Fellowship was a sponsored fellowship by the society. So we get free membership to SCCM. So that was my first time starting to learn the great resources that the SCCM was offering. And it was also during the era of COVID, where there was a lot of stress in all aspects of life and work. So I was very fortunate that I participated in one of the committees as trainee liaison and then start to learn the ins and outs of the society. And that also helped me grow more interest in leadership skills and professional growth in the future for my career.
One of the things that I've heard from my trainees that go to the SCCM conference is how big it is and how sort of overwhelming it is. Can you think back to your first Congress experience and what you were excited to explore and what your memories of that Congress were?
I would definitely echo all of your trainees' experience. I think that first time you come to Congress, it is a little bit overwhelming. Again, lucky enough here at my home institution that I had very powerful SCCM mentorship. So at that time, both Dr. Craig Coopersmith, Dr. Tim Buckman, Beth Taylor, one of our registered dietitians, were all very actively engaged in SCCM, all of them holding council membership. So I had the umbrella of them as I was going, but still nothing quite prepares you to go to a societal meeting of that size and of that multi-professional makeup. And really, that is the part I would continue to tout over and over about SCCM is I think many of us go to our own home societal meetings, be it a neurology meeting, for me being at an EM meeting, and you get to interact with a lot of big people in a big setting. But this is the first time I showed up at a meeting where, kind of like we do in the ICU, I had respiratory therapists, I had nursing staff, I had registered dietitians, I had physicians, APPs, the gauntlet, therapists there. And it was amazing to see that kind of collegiality, both at the National Congress level, but then as you started to going to these subsection meetings or these educational symposiums, you would see the speakers had that that same makeup and the conversations that had. And all of a sudden you would get these different perspectives from all the people that are trying to provide that state-of-the-art care there in front of you. And it was just amazing to see all that, to get excited about it, and to then want to take some of that back to your institution.
I definitely agree that SCCM Congress offers a very wide variety of knowledge and spanning off from physicians to non-physicians. And I want to say, remembering my first SCCM Congress, it was a virtual conference. Fortunately, the reason I say that is because there was recordings and there are so many amazing things happen simultaneously. And my biggest fear was I don't know which one to choose because there are two I am super interested things happening simultaneously and I can only be in one place at one time. So the virtual meeting provided a lot of opportunities for me to actually listen back to the recordings and I didn't miss anything that I was interested. And I think SCCM is still offering virtual recordings for all the congresses, even now we're going on in person again. And one of the best advice that I've received working as a trainee liaison in one of the committees was go to the sections that you have least amount of exposure in your daily practice, because that's the best opportunity for you to learn the up-to-date practice that you can continue to improve yourself and being a well-rounded intensivist when you're working in the ICU to provide the best care for the patients.
We should tout that because I think the recordings are still available and that's free as part of your Congress. You still get access to those.
Yeah, I think people don't take enough advantage of those. I know I don't, but I definitely know that they're there. And it is something that people need to take more advantage of. Or for those people who, like myself this year, can't get to Congress because of one reason or another, because someone's always got to be holding down the ICU to be able to get those recordings and listen to them. Congress is a great opportunity for us all to connect, but there's 52 weeks in the year and only, a few days of Congress. So how do you remain engaged with the society in those other 52 weeks?
No, that's a great question. I think one thing I go back and tout for those that are, hearing about this and have not yet been to a Congress session. I actually just added this to my calendar this morning because I saw it pop up. But there is a Break the Ice session that they have. I think this year it's on Saturday afternoon, but it's a designed session for those first-time Congress attendees. And what it's designed as is to get those attendees to come to a situation where they can intermingle with a whole bunch of people that have been there previously. They have some food there, and it's kind of a low-key, low-threshold environment that allows people to talk and meet people. And really what happens at Congress, it's those connections you make that allow the other 52 weeks of the year to remain engaged. I mean, the other part I would say is, as you go to Congress, and I think Dr. Wang said this great, you figure out an area that you have an interest in. Don't spread yourself so thin that you're going to 10 different interest areas. Pick one or two and focus there. Get the opportunity to meet some folks in that domain, get engaged and try it out. And that may be your focus for the next year or two where you go to their committee meetings. Oftentimes they have an email listserv or their meetings will get posted and you can remain engaged, not only from meetings, but emails, discussions. I have folks kind of contact me all the time asking about setting up certain parts of your critical care program. There's obvious opportunities by you making those connections and then continuing that out that you can remain engaged in the society.
And I'm going to add on from the most junior person perspective, since I just freshly graduated less than 3 years ago from fellowship. I want to say take the opportunity to participate in the sections of your field, because most of the sections have a designated trainee liaison position for the trainees. And that would be a great opportunity for trainees or junior faculties to get involved with the society. And it's going to take a lot of time to volunteer, but the reward that you're gaining, because the opportunity to know the great minds in the field and the great leaders in the field, and the opportunity to build connections with them is going to carry you a long way for your career. And I am definitely benefiting from all the effort that I devoted into volunteering at SCCM.
Dr. Wang, I think, another part of that, as you mentioned, you made me think about it. When you do your membership component, you get access to 3 different societal areas. So you can pick 3 sections that you want to be part of. And that's just included as part of your membership. And by doing that, you automatically get put on their web board. So you receive all of those web messages that get posted out there. That's a great way to see ongoing questions that get posted, things that people want to discuss. And then the other part I would tout is don't underuse the web resource. I mean, about once a month, I usually log into my SCCM account just to look. And there's lots of stuff on there. Actually, I recently last year decided to sign up. They have this ongoing question bank. For those partway through our careers, the knowledge acquisition part is something to keep going on. And so those question banks and opportunities to do those are a great opportunity to just kind of be engaged daily.
That's a great point. And, there are a lot of societal resources that are out there. Beyond that question bank, is there anything that either you go to regularly to remain engaged and help yourself develop more?
So I think in the section web pages, there are a lot of participations of discussions that people posting their questions as far as the practice or sometimes even billing questions. And I want to say a lot of problems are universal across the states, and it's not your institutional problem. And I actually have learned a lot from all those postings, and I try to be active and provide my 2 cents from a junior person's perspective. But a lot of things are quite universal, and sometimes it's also comforting to see that you're not the only person who's struggling in this world. There are some other people struggling with the same problem at a different institution across the state. So that's a good resource, and just check back into your section webpage here and there. And I found it very rewarding myself.
Yeah, the other one that jumps to my mind all the time, and we do this monthly. Our unit has a unit-based QI type meeting where we talk about ongoing needs, ongoing issues, and the wealth of resources that are at your fingertips on the SCCM web platform. Things from ideas about rounding checklists or spontaneous breathing trials or stress ulcer prophylaxis, getting Foley's out of people, line dwellment. There are resources there that when that question comes up in your QI meeting, I'd encourage all of you out there, go to those resources and bring them back to your unit. The society has set up resources for you to just basically take out of the box and apply to your own domain. One of the things I do weekly when I round in the unit, we do a week at a time. And one of the reading assignments early in the week I give the trainees is I have them look up Choosing Wisely. And now our society, as the owner of that, has 2 different Choosing Wisely lists. And I make my trainees come back and report on both of those lists. I ask them, how are we doing as a unit? These are, the bread and butter things we should be doing. But again, the society is set up to make us have that success back in our home domains.
Those are great things. The other thing that I think about is what is it like to be on a committee in the SCCM? I'll just throw out my own personal history, which has mostly been as one of the podcast hosts for the past several years. And just the number of people I've gotten to meet through that has been really remarkable and fun. And so that to me has been one of the great parts about being on a committee is just the new people that I meet. But what about for the two of you? Fajun, you've been on several committees. What has that brought to you, both personally and professionally?
Yeah, before talking about that, I want to say that before joining any committee at SCCM, I used to think that you have to be really, really have a brilliant resume before you can join or take a position in the committee. And that's not true. As regular and mediocre as me can serve on a committee, I think most people can. So I want to kind of break the ice for people who have fear to apply for a committee position or join a section in the society. On the flip side, I do want to say that it's very helpful and it's a great learning experience to serve on a committee, and when you have the opportunity to work with more senior person and peers on the project to promote critical care in certain field. So I am a subcommittee member on the neuroscience section. I was a trainee liaison, and then I transitioned after graduation. Now we're working quarterly newspaper for the neuroscience section that we're trying to share the knowledge to more broad population and the entire critical care community so that the intensivists who didn't have the specialized neurology training can start dealing with some common brain conditions so they're not freaking out in a more resource limited situation. Because as the prevalence of stroke keeps going up, everybody's seeing more and more critically or neurologically injured patients. But there are only so many tertiary care centers that have dedicated neuro ICU. And that's also kind of my personal pet peeve is how can we reach out further to help more folks instead of having a dedicated 20 beds here in the middle of St. Louis while we have 4 million population in the underserved area surrounding us where 20 beds is not going to serve enough 4 million people. So I think there are a lot of things that we can do on the committee, and it's a great learning experience for me as a junior person to help me grow professionally in my career.
Dr. Wang, I would say, first of all, you're too humble about yourself. This is now my second national involvement with you. You're doing great. I would just throw out as well, I had this confusion, and I still see as junior folks come into SCCM, being part of a section is very different than being part of a committee. When you want to get involved in a committee, I think as Dr. Wang alluded to, all too often people think, oh, my CV isn't built up enough. But annually, there's a call for committee involvement. I think we sometimes miss that as we're coming into the society or don't understand that kind of legwork that happens behind the scenes. But usually in the spring, about a month or two after conference, you'll see it posted on the SCCM webpage. You can go there and it'll say call for committee applications. And that is your opportunity that was said to basically go in there and see the various committees that are available. You know, everything from being involved with research opportunities, educational opportunities, but you can pick, 2 or 3 of those committees that you want to apply for. And as you apply, you will upload your CV, you'll write a little letter of intent. And that letter of intent is where you get to tout the unique part you bring to that committee. Because as Dr. Wang said, oftentimes these committees are looking for multidisciplinary, multi-professional backgrounds. So whatever unique aspect you tout or you can bring, talk about that. And then, what will happen is out of the 2 or 3 committees you applied for, you'll get selected for 1 or 2 of them. You're not going to get all of them, but that's your opportunity to shine. So once you're involved in that committee, then being engaged throughout the year, go to those committee meetings, volunteer to do things. There will be calls for opportunities for leadership in those, and that's where you can apply for those things. And then as you start to build that pedigree in Committee X, you can then the next year apply for a different committee if you're still interested, or wait the subsequent year. But that allows you to kind of get those connections inside of SCCM and then build on that as you go forward in your career.
One of the things I wanted to roll back to is your stories about getting involved in society. It was both really started in your fellowships. I wanted to know sort of what role mentorship played in getting you to be part of the society, and then how have you gone and sought mentors within the society as you've developed your career?
I can go first this time. I honestly have a lot to say for the mentorship program offered by SCCM. So I was part of the mentorship program. I was a mentee participating in the program that offered international medical graduates intensivists. That was a new initiative last year through SCCM. And it was an amazing experience that we had for the past year. They pair you with the mentors that you show interest in the area. And I was interested in the leadership position because of my new position as a medical director. And I want to learn how to run a unit efficiently and effectively, and how do we provide the best care. So I was paired with a unit director at Detroit, and we had monthly meetings. We sat down, discussed how to make things better. And then I was also given assignments to think about things and come up. I think it's definitely a commitment that as a mentee, we have to put in and spend time to finish up the assignments. But it was a great resource SCCM has offered to everybody. And I think it's a great program. Personally, as an international medical graduate, I would recommend all the international medical graduate intensivists to participate, especially junior person. And I do hope that as I gradually progress in my career, I hope to serve as a mentor in the future, because I want to give back to the folks that I can help more people and carry all the flags.
I would tout that for all the listeners out there. If you are a trainee right now and your program is not sponsoring you somehow as a member of the society, talk to your program leadership. That is something that at your institution, your program director is a member of SCCM or some other faculty members in SCCM. They can have a sponsored mentorship program, a sponsored trainee program, where you as trainees can get free access to these resources that we're actually talking about. I do that for all of my fellows. In fact, I've had residents who have shown interest in critical care earlier in their career come to me and ask about that. And we have gotten them access to that membership to kind of jumpstart their careers. I always jokingly tell them, I'm a card-carrying member of SCCM. I want everyone to be a card-carrying member of SCCM. On top of that, early involvement or early mentee mentorship relationships. I would be remiss if I didn't call out by name Carrie Sona. Carrie Sona is the clinical nurse educator at our institution. She helps support our local unit, but she's also one of the only clinical nurse educators in the country who has fellow status. She was the winner of the Grevnick Ethics Award last year. But an amazing mentor, not a physician, not in my specialty, not an EM, but I have used her throughout my career to ask questions of how do we do better? What have you seen in the society? How have we done these things? I was recently elected to council. The first thing I did is I went and found Beth Taylor, registered dietitian who was on council, and said, Beth, I need you to give me some guidance. I need you to mentor me. Tell me what to do. How does that work? So there's these opportunities with the connections you make throughout the years. You can then go back to those people and talk to them. And across the board, I think anyone inside of the society is not going to say no. They're going to say either, yes, I'll talk to you, or let me get you plugged in with the right person.
Brian, you just brought up the fellowship in critical care medicine. Maybe you could speak a little bit about what that means and how do members go about becoming fellows in critical care medicine?
Yeah, I'd be remiss if I didn't, as the incoming chair of that group. So, as you said, I've been lucky enough over the time of doing that on that committee to review a lot of applications of folks applying for fellowship status. And we have an amazing society. I mean, just kudos to the members out there and the things I get to read about you and see about you. First of all, again, I think becoming a fellow in the society shows an additional commitment to critical care and an additional kind of professional desire to have those letters after your name. And probably the one difference I always remind people is, and again, I don't want to discredit any other fellowship that you get from another society, but I think we hold a bar a little bit above and beyond the being a member, paying your dues, and going to meeting. We actually ask our membership to fill out a pretty extensive application packet. For those in the academic world, I typically tell you as you're going from assistant to associate professor, if you're working on your associate professor packet, that's the time to consider applying for fellowship status in the society. What you'll see in that packet is we ask you to not only have some bread and butter of temporal requirements and multidisciplinary care and making sure that the SCCM model is being followed at your institution and you really are an intensivist or practicing critical care in some realm. But then we ask you beyond that to have 3 separate areas. So we talk about this idea of engagement. What have you done for the society? What have you done for critical care in general? And we're looking for tangible items. We're looking for things that you have produced, be it a guidelines document. What have you done to help further our mission? So this idea of engagement or leadership. The next area we look for is something called scholarly. And scholarly takes a lot of different forms. It may be something as, book chapters. It may be the written form. It may be the, didactic form. Scholarship, it's engagement. And then the third part that you have to kind of bring to that application packet is program development. So what have you done at your own shop that has continued to show something new in the realm of critical care? And that doesn't mean a training program. That may be something like an ECMO program. That may be something about a spontaneous breathing trial program. But we want to see a dedicated component of data that shows that you furthered critical care at your home institution by developing a program and then following through on those aspects of that. And because of that, that bar becomes a little bit higher to obtain fellowship status inside of our society. There is an annual meeting. Again, I'm going to tout this. If you're going to Congress, it'll be a tape session, but it'll be an open session for about an hour and a half. Or come to that room. We're happy to kind of talk to you. We're happy to look at your CV, happy to provide you guidance. We actually have representatives. So the folks that review applications for fellowship status come from all of these multidisciplinary backgrounds. So we have physicians, we have nursing, we have PAs, we have respiratory therapists, pharmacists. So that whole committee makes up the background of SCCM that then reviews your applications. And those people sit at that meeting at Congress, and we have their resources to help you talk through things. The other part I would say is if you go to the SCCM webpage and go look under becoming a fellow, we've actually created some documents that may give you some ideas of how you can do things like program development, engagement, scholarly. And it kind of gives you a layout of some of the things in your field, be it respiratory therapy, be it physician, and it'll tell you some of the things that you can do there.
So, I'm going to call foul on our podcast just a little bit that we've talked a lot about the multidisciplinary society that we are, and we have 3 physicians here talking about it. But I want to highlight just for a second that when we talk about fellows in critical care medicine, we're talking about everyone who works in that critical care environment. One of my mentors, Mary Faith Marshall, who is an ethicist and nurse, is a fellow in critical care medicine. And I would be remiss if we didn't, really spell out that fellowship in critical care medicine, unlike some other societies, is really open to everyone who is a member of the society. So maybe next year when we do this, we'll make sure we have a more representative group of people talking.
I was just going to echo what you just said, that even though we have 3 physicians here talking about the FCCM, but I do want to say that I've also learned a lot when I was in training and even now from my non-physician colleagues, because again, I think critical care is a team play, that everybody is a team member and everybody is contributing a lot to the patient care. And it takes a village to take care of a critically ill patient. And I still believe in that. And I want to say that it will be my goal to become a fellow in the next couple of years.
I'm sure Brian's going to be looking for that application sometime soon. And anybody who is a fellow will be happy to talk to you. Before we wrap up, I just want to know, is there anything that we should have mentioned in this discussion that we didn't about how people can really supersize their career and take advantage of all the society has to offer?
Dr. Enfield, the one thing, I think all of us have touted, like you said, because I agree, it's probably a foul on us. And I noticed that when we had the three MDs behind all of our names. But I think the names that we've all talked about have been non-physician folks that have supported our careers. The other unique part, I think, of this panel that you were able to put together, both Dr. Wang and myself, we come from kind of niche background residency specialties that were not, welcome is the wrong word, but were not maybe embraced by the critical care components. At least early in my career, when I became an intensivist, there was not a pathway to certification. Dr. Wang knows, recently neurocritical care just went through kind of a battle to get ACGME status to get certification. And so there's a little bit of a unique background of some pioneership that both of us probably bring to the table. And, part of that of me touting things you can do, again, I think both of us, as we've come into the society, have realized there's a lot of things that we bring from our primary backgrounds, be it emergency medicine, being in neurology, that allow us to help strengthen what the society wants to do. And critical care is not the barrier of just the ICU walls, as we all know. I mean, I think you mentioned a second ago there, post-intensive care syndrome. That's a clinic, but that's something that we own, something that we can help patients with, this post-intensive care delirium. In my realm, taking care of people as they come in from the pre-hospital setting. We've done a lot of work of pre-hospital, ECPR, ECMO activations. So there's all these different unique aspects. And I challenge you out there for all of the listeners, you're in some type of a unique niche, whether you realize it or not, that you can bring to the society. And you will bring something new to us, and we want that. So bring all of that good and add to us and build to it. And you will see only a benefit of our end and also of your end.
Fajun, anything you want to add?
Absolutely. I want to echo what Dr. Wessman was saying, that definitely me being a neurointensivist as kind of a quote unquote new creators in the world of critical care. A lot of folks unfortunately still see me as a neurologist, not an intensivist, even though I can do all the things intensivists can do and with the expertise in the brain part. But that's also kind of part of my pet peeve is when we are forming this neurocritical care fellowship at SLU, that I really want to train intensivists with expertise in the brain, because I think the future for the intensive care is everybody can be intensivist. You're just going to have a different niche. You may be a pulmonary intensivist. You may be a cardiac intensivist. You may be a brain intensivist. You can be a kidney intensivist. Everybody can be intensivist, because critical care is so multidisciplinary that everybody can pitch in their own expertise. And another thing I want to shout out for SCCM is the Learn ICU resource that everybody has access to. And a lot of great contents were constantly being updated from that resource. That personally, I will log in like every other week or every month just to check on the things that I'm interested. And it has a lot of helpful resources that for everybody at different levels to access to.
Yeah, Dr. Wang, just to build on that, and again, the society, we didn't mention another niche that they throw out there. I think it's called task force. So every so often, the society will identify something they need help with, and they will create a task force to look at that. I've been lucky enough to be in a couple of those task forces throughout my career, but they look for the expertise that we as members bring to them. But one of the most recent ones I was just on, and again, I have to give a shout out to Sam Tischerman, but looking at critical care as a specialty, we've done a pretty extensive Delphi process. This is a coming attraction for publications. You'll see it come out this year. But almost 85 to 90% of the core knowledge that we all get as intensivists is the same, regardless of the amount of silos we create. You're right. There's another 10% that may be niche, maybe, niche about the brain, maybe niche about mechanical cardiac support, maybe niche about transplant medicine. And that's good. We want that. But I'd encourage us all to look at the similarities. And that's where we continue to strengthen the society as intensivists, bringing that common knowledge together and the common expertise that we have as we grow our specialty.
I can't think of a better note to wrap this episode of the Society of Critical Care Medicine's podcast. You guys have both been excellent, really shared a lot of details, and encourage all of our listeners to go to the Society of Critical Care Medicine's webpage, look at the resources that are out there. And if you're listening to this on your favorite podcast app and you like what you heard, consider rating or reviewing. For the Society of Critical Care Medicine's podcast, I'm Kyle Enfield.
Kyle B. Enfield, MD, is an associate professor of medicine in the Division of Pulmonary and Critical Care at the University of Virginia. He received his undergraduate degree from the University of Oklahoma. Join or renew your membership with SCCM, the only multi-professional society dedicated exclusively to the advancement of critical care. Contact a customer service representative at 847-827-6888 or visit sccm.org/membership for more information. The SCCM podcast is the copyrighted material of the Society of Critical Care Medicine, and all rights are reserved. Find more episodes at sccm.org/podcast. This podcast is for educational purposes only. The material presented is intended to represent an approach, view, statement, or opinion of the presenter that may be helpful to others. The views and opinions expressed herein are those of the presenters and do not necessarily reflect the opinions or views of SCCM. SCCM does not recommend or endorse any specific test, physician, product, procedure, opinion, or other information that may be mentioned.